Hi, my name is Steve Hinkley, and I'm the President and CEO of the Adventure Science Center. And welcome to The Hub, another conversation with an expert in science in the community. Today, I'm joined by Dr. Ritu Banerjee, who is with Vanderbilt University Medical Center, the Department of Pediatrics, focusing specifically on infectious diseases with children. Welcome, Dr. Banerjee.
Thank you so much.
So, Dr. Banerjee, before we get going, would love to understand a little bit more about your role at Vanderbilt and the work that you do there, and then also potentially how that relates to the long fight that we've had with COVID.
Sure. So I'm a pediatric infectious diseases doctor. So what that means is I take care of children with complicated infections. Sometimes they're in the hospital. Sometimes they have milder infections and they remain as outpatients who I can see in the office setting or the clinic setting. So I spend a fair amount of my time doing patient care, which is really fun. I really love it. I love meeting and speaking with the children and their families, and they always teach me so much. I also spend some time teaching medical students and pediatric residents and pediatric infectious disease fellows, which is also really fun and really rewarding. It's nice to see young people so excited about going into a field that I love. And then I also spend some time doing clinical research, specifically in the field of antibiotic-resistant bacteria. I am not a virologist. I never dreamed that I would be doing a lot of clinical research in a virus like the one that causes COVID, but that's also been a really, really interesting part of my job over the past year, as you can imagine. And then I've also been doing some advocacy lately, talking to schools, talking to teachers and parents and coaches about how to keep kids safe during the pandemic.
We're glad to have you here, and thank you for taking time out of your day for talking with us about the sort of new world of the youth vaccine that has now emerged. So the adult vaccine has been available for a little over a year now, and recently the youth vaccine became available. So what I'm curious to hear from your standpoint is just your perspective on how you're feeling at this moment. Is it one of anxiety or joy or relief? Help us understand how you're feeling.
I'm excited. I am thrilled because we have been waiting for this since the beginning of the pandemic. The youth vaccine means that we can protect children. We are one step closer to ending this pandemic and getting back to life as we knew it before the pandemic.
And how does this vaccine differ from the vaccine, for example, that I took several months ago? Is it the same vaccine developed in the same way, or is it a different formula?
So it's almost the same. The only difference is that it's a third the dose of the dose we're giving to adults and older adolescents. And the reason it's a third the dose, it's 10 micrograms instead of 30 micrograms, is because the 30 microgram dose caused a little more side effects like fever and fatigue in the young children. So the 5 to 11-year-olds are getting almost the same formulation, a slightly lower dose. It's still 2 shots administered 3 weeks apart, just like we do for adults and older children.
Right. I took my 6-year-old son to get his first dose of the vaccine last week, and he was certainly a little bit nervous, but having gone through it, it's fascinating, particularly at Vanderbilt where we got ours done, what a great process they did in terms of getting him in, making him feel comfortable. And so now he'll go back for his second dose in just a few weeks. And so we're glad as parents to be at that point where we can get him vaccinated. Similar to with the adult vaccine, there seems to be obviously a pretty good speed with which the youth vaccine was developed. Help me understand how that came about. How are we able to get these vaccines so quickly available and deployed?
Yeah, it's a great question. It's one I hear a lot. So it's important to step back and realize mRNA vaccines have been in the works for decades. And also people have been studying coronaviruses for decades. So when the virus that causes COVID came about, we were able to take these technologies and all the knowledge the scientists had from studying other kinds of coronaviruses and just put them together. And then I would say this is the most studied vaccine we have out there right now. So it's a bit of a myth or a misconception that these vaccines were developed too quickly and they're not studied well enough. There have been over 400 million doses of the Pfizer vaccine administered in the US alone. And so we have a lot of information about the effectiveness of the vaccine and the potential side effects of the vaccine. It's very well studied, and it was not developed too quickly. In fact, one of the reasons the youth vaccine took so long to be approved for use is because we wanted to make sure it was studied adequately in the 5 to 11-year-old age group.
Well, that's great. I'm certainly happy to hear that we've taken our time and done the due diligence on all of that. I hear a lot and I read a lot about folks out there who maybe got vaccinated themselves as adults and they're hesitant to vaccinate their children. For that group of people, what is the advice that you would give them, perhaps to sort of move beyond some of that hesitancy to get their children vaccinated, assuming they can be?
Sure. Well, I think that the science and the data speak for themselves. So we know that over 4,000 children were included in the 5 to 11-year-old trial, and that the side effects in these children were very well studied, and they're essentially the same side effects we've seen in the older children and the adults. So nothing surprising happened to these children. They had arm pain, arm swelling, some redness maybe at the site of the injection. That happened at comparable levels in the 5 to 11-year-olds, just like it did in the older patients who got immunized. Fever and fatigue and headache, these are systemic side effects. That happened much less commonly in the 5 to 11-year-olds than in the older people. So it's very safe. And importantly, not a single child enrolled in the trial had myocarditis or inflammation of the heart, which is a side effect that a lot of people are worried about.
Yeah, that's great. And speaking of some other effects from the vaccine, one of the things that we've seen over the last year are the breakthrough infections, particularly it seemed with the Delta variant in adults. Is it still possible that children who are vaccinated against COVID-19 could still get COVID-19? Or is the vaccine some sort of magical shield that protects the virus from getting in the body? Help us understand a little bit about what the vaccine does and does not prevent.
Sure. The vaccine, it is possible to get reinfected after you've been vaccinated or after you even had a natural COVID infection. And the reason is because the protection, the antibodies that your body makes in response to a vaccine, they wane over time, they decrease over time. But there's still a fair amount of protection against severe COVID. So anybody who has a reinfection, they might just end up having no symptoms or very mild symptoms. They typically do not have severe symptoms, and they typically do not require hospitalization. So for those reasons alone, it's really important to get vaccinated because it reduces the severity of the disease.
That's great. That's great. So I'm going back a little bit to my biology days of high school and then also in college, and understanding that there are, generally speaking, two forms of immunity. There's the acquired that we might get from taking a vaccine, and then there is the natural immunity that we might get from actually having the disease. Is there a difference between them? Because I know that part of the question with COVID has been, I would rather get COVID and develop the natural immunity, which seems stronger than going to get the vaccine and having acquired immunity. Is there, from a physician standpoint, would you recommend that people wait to get COVID, either the adults or the children, to get the natural immunity, or is the acquired just as good?
So I definitely would not wait to get natural immunity because COVID disease is a bad thing. Some children recover just fine, but some children end up with very severe disease that requires hospitalization, sometimes intensive care. And we cannot predict which children are going to end up with severe manifestations of COVID. So therefore, I absolutely would not wait for natural immunity. That being said, there is protection that's afforded that's develops once you recover from a natural COVID infection, but it's not lifelong. So the protection does decrease over time. And so even people who've had a natural COVID infection should get vaccinated because that boosts their immune system and gives them even more protection. Natural immunity in addition to vaccination.
Okay, great. And for those who may have had it, either adults or children, what's that time frame after which, if they've had COVID, that they can actually be vaccinated?
Yeah, we are typically saying, and this is also what the CDC says, wait until your acute COVID infection is resolved. So no more fever, no more cough, and you're out of the 10-day isolation period, and then go and get your COVID shot. Okay. There's no need to wait an extended period of time. The only situation where you should wait is if you've had a complication of COVID known as MIS-C, which stands for multisystem inflammatory syndrome in children. This happens about a month after a COVID infection, and it causes inflammation in multiple different organs of the body. So children might have myocarditis or swelling in the heart where the heart is not pumping as well, swelling in the liver, a rash, swollen lymph nodes, and lots of fever. If a child has been diagnosed with MIS-C, they typically are hospitalized, and they are treated with medicines like steroids and intravenous immunoglobulin, but they generally recover. And we're saying these children who've recovered from MIS-C should wait at least 3 months until they get a COVID vaccination.
Okay, that's great. So we're kind of at a point now, it seems, that there are folks that are sort of weighing in the balance the risk of getting COVID and the risk of being vaccinated, not knowing, really fully understanding the long-term implications of either. So from your perspective, which way does that scale tip? Does it tip towards being vaccinated or tip towards risk being exposed to COVID?
Right. In my opinion, the benefits of vaccination far outweigh any risks of vaccination. So the benefits are reduced number of infections, reduced number of hospitalizations, and complications of COVID, such as MIS-C, the multisystem inflammatory syndrome we see in children, and also long COVID, which happens more in adults than in children, but we do see children with long COVID as well. And of course, death. This is a vaccine preventable illness now in children 5 and older. And we need to prevent these bad outcomes with vaccination. The flip side, what are the risks of vaccination? They're relatively mild, localized symptoms like arm swelling, tenderness, redness, maybe some fever, fatigue, or headache. There's a very low risk, increased risk of myocarditis seen in young adult males primarily. The risk is there after vaccination, but it's low, about 40 to 70 cases per million doses of vaccine that have been administered. And then just also keep in mind that the risk of myocarditis from vaccine is much lower than the risk of myocarditis from actual COVID infection. It's about 16 to 30 times higher if you actually have COVID infection versus COVID vaccine. So in my opinion, the benefits far outweigh the risks of vaccination.
And that's really, to some extent, you're speaking about an individual level, like what's my risk for certain outcomes. But there's also a bigger collective mindset that can be adapted to that too, right? From the vaccination standpoint, is it fair to say that as a population, we are less susceptible to further variants if there are greater numbers that are vaccinated? Is that a fair statement?
Yes, absolutely. If we have more people who are vaccinated, there will be less circulating virus, and that in turn will lead to less mutations in the virus and emergence of new variants. We know that the Delta variant was so dangerous when it came to our area in Nashville last summer because it was so much more contagious. We had so many more people who were infected, and our children's hospital was overflowing with hospitalized people with bad COVID disease. And so if we can reduce emergence of new dangerous variants like that through vaccination, we should. It's a benefit not just for the individual and their household, but also the community.
Thank you. And so to summarize, for those who are 5 and up and eligible to be vaccinated, get vaccinated. Now, let's talk about those that are still not eligible to be vaccinated. I've got a daughter who's 3 and certainly isn't eligible for this particular round of vaccinations. What advice do you have for that population, for the families such as myself and my wife who've got children under the age of 5? What can we do in the meantime? And is there a time horizon for when that vaccine might be available?
Yeah. So all the vaccine companies are studying vaccines in children younger than 5. But again, they need to enroll enough young children in these trials to make sure they have the right dose that's effective and safe without a lot of side effects. So that will take some time, and it probably will not be here, for another year or 2 is my guess. My advice for those families like yours with young children who are not able to be vaccinated yet are to get everybody in the household who is eligible for vaccination to get their shots. That will protect your young 3-year-old from getting the infection from all of you. And then also to, mask up and try to avoid some of these large social gatherings as much as you're able to until we get this pandemic under control.
One of the questions that I think many have is the eligibility for the different types of vaccines. The adult version and the youth version seems to be based on age versus other characteristics, size, and so forth. Help us understand a little bit what is making that delineation at the age of 12. And then from there, if you have a child who's about to turn 12, should they wait for the adult vaccine, or should they go ahead and be vaccinated now with the dosage that they are eligible for?
Sure. So vaccines are really the only medication that we provide based on the age of the child rather than the weight of the child. And that's because of the maturity of the immune system. Young children have a really robust immune system and response to the vaccine that really changes as they get older and enter puberty. They become more like the adult immune system as they get older. So that's kind of the cut point of 12 years and under for the 10 microgram dose came from that kind of background information about the immune systems and the maturity of the immune system in children of different ages. Now, if your child, and the CDC specifically recommends that if your child is 11 at the time of the first dose, they should get the lower dose of the vaccine. And if they turn 12 in between the first and second dose, for the second dose, they should get the higher dose of the vaccine. And again, that's the recommendation from CDC based on the maturity of the immune system.
And as there are potentially other brands on the horizon for different vaccine, is there a difference in terms of which version of the vaccine that they should get?
So we don't know that information yet. We know that Moderna, also an mRNA vaccine, has been studied in young children. We haven't seen that data yet, and the FDA has not approved it for use in the United States yet. So right now, for the 5 to 11 years old, only the Pfizer vaccine is approved for use.
Okay, and so the message, I guess, would be don't wait.
Absolutely, don't wait. If your child is going to turn 12 in a few weeks or a few months, get the vaccine now so that you can get them protected sooner rather than later.
Well, that's great advice. One of the other things that again, I see a lot are folks that are waiting to evaluate and do their own research about the vaccines. Again, as a pediatrician, what would be your guidance to these families? You know, there's just so much information. There's a lot of sort of noise out there on the internet or wherever folks might be getting their information from. And in your mind, what are, other than conversations like this, what are places where people can go get good, reliable, accurate information?
Yeah, there is a lot of misinformation out there. So my sources that I think are great resources for families are the CDC, the U.S. Centers for Disease Control website, and the American Academy of Pediatrics, or the AAP websites. They have a lot of really, really good factual information for parents.
It's wonderful, and we'll put links to both of those in the video as well. The last question that I have for you is a little bit open-ended. From again, your perspective as a parent and certainly someone that's been involved in the fight against COVID, particularly for children, what's the message that you would want to share with people? And at this point, you know, what are the things that you want folks to understand and to hear from your perspective?
Well, I think we're still in the midst of the pandemic, but there's a lot of reason to be optimistic. One is that we can now vaccinate everybody 5 and older. And we just need to encourage people to get that done. And then we also have better therapies for patients who do get sick enough to be in the hospital with COVID. So although the infections might continue to happen, the hospitalization rates have stabilized and the deaths from COVID have declined. And I think that's because we have a better understanding about how to treat these patients. So I think those are reasons to be optimistic. I think we have a lot of work to do. We're still not out of the woods. And the resurgence of COVID in pockets of Europe that's happening right now, and in other parts of the United States that's happening right now, are cause for alarm. These are pockets of under-vaccinated people, though. And so we know how to get on top of this pandemic, which is to get people vaccinated. Vaccination protects not just your child, but also your household and your community. And it will get us closer to how life was before the pandemic. Maybe someday we can imagine having our kids go to school without wearing masks.
Yeah, I know as a parent, I am very ready for that day, and I know my kids are too, where they can just resume being normal with their friends again and so forth. And we've seen glimpses of that in the last several months, but we're still a ways from being completely back to normal. Dr. Banerjee, I want to thank you so much for being with us today and really appreciate your time.
Thank you so much.